Welcome to Conversations with myself, Nick Conn. Just little old me today. Got no guest in the studio, so no one really to bounce my terribly bad jokes off. Because I remember I was reflecting on the way here about how disgusting my house was when I was living through addiction, with dirty plates in the sink and piled up and not hoovered. I remember Mike Tyson came round and he came into my dirty house and said it was a meth. Honestly, I give up, because how much worse can they get? How much? So anyway, we're going to move on and we're going to talk about a workshop today that I love, and it's called The Stages of Change. So anyone that's kind of going through addiction, unsure which stage you're at, this will really help you, hopefully motivate you to move on to the next stage, and doing it in really 5 small steps. Okay. Anyone that's kind of got a loved one that's going through, hopefully you can help support them, see which level they're at and try and help them move on. So this model was developed in the 1970s in order to really help people stop smoking. And then throughout time, it kind of developed, and that was used to help people suffering with substance misuse. And it really became a great tool for that. So firstly and most importantly, the model demonstrates that change is not simply a binary position of either having changed or not changed. It's in fact a process in which people pass through discrete phases, each denoted by a particular cognitive state. And there's 5 main stages in this basic model, as I said, and hopefully you can see those now on the screen. So one of the most important aspects of the model is its comparative universality. Almost everyone will pass through these phases in a generally predicted manner. So this predictability can be very useful, and as a result, simply ascertaining at what point you currently reside on the model can be in itself very useful and a positive step. So as you can see, the first one is pre-contemplation, and people at this stage don't want to make any change to their habits and don't recognize that they have a problem. They may be pessimistic about the ability to make a change, or even deny the negative effects of their substance use. So they selectively filter information that helps confirm their decision not to change. And as you're probably aware, this stage is referred to as the denial stage. Unfortunately, it's difficult to reach or help people in the pre-contemplation stage, and it may take an emotional trigger, an event, or some kind of, consequence to snap people out of this denial. Then you move into the contemplation stage. So during this stage, you're weighing up really the cost, the finances, the amount of effort, the benefits of lifestyle modification. You're contemplating whether it's something that would be worth it, or even if it's possible to do. People can remain in this stage for years without actually preparing to take any action. Often setting kind of very powerful, motivating goals and visualizing results can be very helpful for someone in this contemplative stage. If you can identify new ways that making a change will benefit you, then the benefits will begin to outweigh the costs. So as addicts, we tend to seek pleasure and avoid pain. So the more pleasure you can ascribe to making a change, the more likely you will take action and succeed. So now we move into the preparation stage. So people in the preparation stage have decided to change their negative habits and have a specific time scale in mind. If you've reached this stage, really congratulations, because to get to this stage is admirable. But now we've got to keep moving, yeah? So you may have just set an appointment with a doctor, a therapist, or other professional, purchased some books, or even started a therapeutic program or gone to rehab, whatever the case may be, by your own choice. And that's really important. So like I said, well done if you've done that, because you're now moving in to the action stage, which is stage 4. And the action stage is the process of changing your lifestyle, reducing or eliminating your consumption of a substance. This stage can still involve some planning, but it must involve really some direct action and perseverance. And remember, consistency is key. Individuals in this stage are at the greatest risk of relapse, so it's important to leverage any techniques you can to stay motivated. It's also important to remember that directly stopping your consumption may not be the only action that needs to be taken. And sometimes a great deal of lifestyle changes, like changing your job or doing a better diet or exercise, or the people that you hang around with, are equally as important to do. Yeah. So then you move into the maintenance stage. This stage is successful, and it's a sustained lifestyle modification. Yeah. Many people tend to bounce between contemplation, preparation, and action stages. And in other words, what we call they do, it's like the yo-yo effect. So one way of preventing this yo-yo effect from happening is to make small but permanent changes in your habits over time to move in kind of a more positive and lasting direction, and to ensure you learn, from any setbacks that you've encountered. In addition, yo-yo changers should understand that maintaining change and change are two totally different things that require different approaches. And it's often not that difficult to maintain, and given a level of positive living just by remaining consistent. It's very difficult, however, to prepare and take action to change your life. Our habits are resistant to change, so trying to change them takes a lot of effort that requires a substantial commitment, both mentally and physically. So congratulations at whatever stage you're at, and if you are preparing to move on to the next stage. But keep moving on. You got this. And thank you. Please make sure you subscribe, and you'll get updated on all the latest episodes that come out. Thank you.